Hello and welcome. I'm Rishika Baruah. You're watching me as a part of the NDTV Banega Swasth India campaign, and today I'm going to talk to you about, the fourth Sero-survey that's been conducted here in India. For starters, what is a Sero-survey? A Sero-survey is essentially COVID-19 tests that are conducted. This is antibody tests that are conducted on a random sample of the population in order to understand what is the general level of immunity that our population has against COVID. So in this case, about 30,000, more than 30,000 people were in fact tested. And the Sero-survey is extremely important. It's an important indicator of just how widespread the infection has been and how much of our population actually has some degree of protection against COVID-19. So there are 4 Sero-surveys that have been conducted so far. And we're of course going to discuss in detail what the 4th Sero-survey has in fact said. The 4th Sero-survey says that around 67% Indians have developed antibodies to COVID. This is a combination now of vaccine-induced antibodies and infection-induced antibodies. Remember, in the previous Sero-survey, it was largely infection-induced antibodies that we were talking about, but now that over 40 crore of our population has been vaccinated, this is a combination of vaccine-induced antibodies as well as infection-induced antibodies. The end result of both of those antibodies is the same. It gives you a certain level of protection against COVID. Now, 67% of the population has antibodies to COVID is good news for India, even though experts say that we're still far from any kind of herd immunity, because the threshold for herd immunity has also changed with the Delta variant coming in. Now, experts say that you need about 90% of your population to have antibodies or to have some level of protection against coronavirus to actually even consider or talk about herd immunity. What we essentially know right now from this data is that 2 out of 3 Indians have antibodies, but 1 out of 3 Indians doesn't. And if you extrapolate that data, that's around 40 crore Indians who still do not have antibodies, which means that 40 crore Indians are still vulnerable, susceptible to a severe COVID disease come a third wave of infections. So, like I said, the Sero-survey is extremely important for the authorities to determine their future strategy. It's extremely important to understand how the infection has proliferated in the country. And, just to also put this in perspective, the 3rd Sero-survey was conducted between the end of December and the beginning of January. The 4th Sero-survey right now was conducted end of June, beginning of July. If you look at the data of the 3rd Sero-survey, which was conducted between end of December, beginning of January, 21% of our population had antibodies. Now, juxtapose that with the Sero-survey that was conducted towards the end of June, beginning of July, which says 67% of our population had antibodies. Now, it's not rocket science to understand that the two things differentiating these two Sero-surveys and the timing is that massive second wave of coronavirus that India saw. So second wave obviously infected a lot more people than was even anticipated or recorded, because a lot of people, remember, get very mild or asymptomatic COVID and therefore don't ever end up getting themselves tested or even knowing that they've had COVID. So the revelations of this Sero-survey are important. This is an important finding for the authorities to determine the future course of action. But having said that 40 crore Indians are still vulnerable, that means these people are still susceptible. We need to ramp up our pace of vaccination because remember, at least 90% of the population needs to have immunity against COVID for us to even be talking about herd immunity. And the fact that 1 in 3 people is still vulnerable, experts say that COVID appropriate behavior and ramping up vaccinations is key to delaying the onslaught of a potential third wave. So this, of course, is the findings of the Sero-survey and what it means for the larger population. But another interesting aspect of the Sero-survey that I want to talk about is the fact that there were children above the age of 6 who participated in the Sero-survey. In fact, around 3,000 children above the age of 6 participated in the Sero-survey. And it does go to show that even 67% of children above the age of 6 have developed some kind of antibodies. These can't possibly be vaccine induced. So it goes to show that a lot of kids have actually developed the COVID-19 infection, but it's been a very mild or an asymptomatic infection in children. But there is also a decent level of protection in those above the age of 6 when it comes to COVID-19. So this is what the revelations of the Sero-survey have essentially been. It goes to show that a certain section of our population is indeed protected. It also has many experts believing that there will be a third wave of COVID in India. Cases will begin to rise again, but it may not be as severe as the second wave, given the findings of the Sero-survey, given the fact that we are vaccinating. We have vaccinated over 40 crore citizens of the country, even though that is still about 6.5% of our total population that's fully vaccinated against COVID. So, well, that's all I have for you in terms of the findings of the fourth Sero-survey, an extremely important indicator to understand the COVID-19 infection proliferation in the country, and of course our degree of immunity and preparedness to fight future waves. Sincerely hope that this video has been useful.